working, I work very slowly. If I feel a pulse, I then try to slow down and come closer to the pulse where I feel that it's a little bit stronger. Then I know that I'm getting closer and closer, and as long as that pulse continues to get stronger, I know I'm honing in on that artery, and then I can move a quarter of an inch or a half an inch away and know that I'm not actually putting pressure directly on that artery. So let's move up to the pelvis now. Let's talk about the sciatic nerve and the gluteals. A lot of people hold a lot of strain in their gluteals and in their rotators, the muscles that rotate the leg into external rotation. And the basic thing that you want to do is to be very careful about not pushing straight down at an angle like this into bone. There's a lot of play. The muscles can move this direction and that direction, up and down, as long as you're working at an oblique angle. This is the important thing that you want to do, and you also really will find that this is an extremely important area that more and more people are becoming aware of, and you will be getting clients that come in for what's called piriformis syndrome. We'll be talking about that in detail later on, but the main thing is that you must realize that the sciatic nerve is going to run in different directions for different people. Some people it will run deep to the piriformis muscle. Other people it will run superficial to, and others it will actually move right through the muscle. So the main thing when you're working in this area deeply and people have tension and they've been told by their doctor to come in for treatment of piriformis syndrome is to just work slowly and tell them that if you feel any sensations going down your leg, any numbness or tingling, then you need to take a little bit different direction, maybe move a half an inch away, but don't be afraid of working on the muscle. You just are probably stretching that nerve a little bit. So don't be afraid of those sensations, but do immediately stop working on that. The next area where the sciatic nerve is vulnerable is right where the hamstrings attach at the ischial tuberosity. And it comes up fairly close to the surface, and you just want to be very careful when you're working around there that you don't move too fast and that you're not going to be rolling over this. That would be particularly important for somebody that's doing cross fiber work. So just feel free to work around this area, but work slowly and inform your client to let you know if they have any tingling or numbness going down the leg. And then moving up the back, I think the basic areas that are important to watch out for are the floating ribs. Underneath the floating ribs, you do have the kidneys. So you want to be very careful about pushing with big broad strokes down that are going to be displacing these ribs. If people have specific pain in their ribs or in the tissue over that, this is an area that I normally work with fingers or knuckles or something like that so that I can give very precise work without disrupting a lot of tissue by having to press real hard, because obviously the broader your surface, the harder you're going to have to press. The other thing we'll talk about at great length is a lot of early massage classes mention about staying totally away from the spine. And I have checked this with physicians, with physical therapists, and you do need to have caution working around the spine, but take a look at a skeleton and notice where these dorsal nerve roots come out. They come out anterior to the transverse processes of the vertebra, and you can do a lot of good by working in this area between the spinous processes and the transverse processes. There are hundreds upon hundreds of little muscles connecting all of these bony segments, and you'd really have to get in here to work, and we'll be talking about how to do that. So don't be afraid of working in the spinal groove between the spinous processes and the transverse processes, and don't be afraid to actually put pressure on the transverse processes. It's not only something that you don't have to worry about, it's something that's a very, very effective tool in alleviating back pain for your patients, and we'll talk about that. The anterior pelvis is another area that a lot of students, with good cause, are very, very hesitant to work around. So you do need to know your anatomy here, but again, if you're doing serious structural work, it is going to be important for you to know how to work in the area called the inguinal triangle, which is this little triangle that comes from the border of the inguinal ligament which begins at the anterior superior iliac spine and then attaches below with the pubic bone. This triangle is bordered below by the inguinal ligament and in the medial border by the rectus abdominis muscle. And basically is a thin-walled area that requires slow, cautious work. You'll be able to feel pulses from the femoral artery. Be sure to use broad pressure and be extra sensitive to distinguishing exactly what you are feeling, whether it's muscle, blood vessels, or organs. It's important for you to know how to be able to work here because you're going to be working on the psoas muscle. More and more clients are coming in for work on the psoas, which is one of the major hip flexors. And so it's important that you get a very clear idea of what's happening in here, where that psoas runs, and where some of the areas for caution are there. So let's take a look at a model that will give a little clearer picture here. So let's look at a three-dimensional model of the psoas muscle and some of the surrounding organs and tissue. Just to give you a few ideas on the landmarks, of course, here's the anterior superior iliac spine, right and left, and here's the inguinal ligament coming down to the pubic symphysis here. So a lot of my students, I find, have a lot of trepidation that's really unneeded when working with the psoas. If you know what organs are around there, then you can work safely and with confidence. So let's just point out very quickly, here of course are the kidneys. They're going to be way above where you're going to be working on the psoas anyway, so they're not an issue. And of course in the middle of the body, you've got to be a little bit careful of the vena cava and the aorta, but we're not going to be working near them anyway, and you notice they split off and go to the inside here. This is the area right around the anterior superior spine, a little bit above and a little bit down below, that we're going to be working on the psoas muscle, which of course is this muscle that goes right here. And of course the iliacus or the iliacus muscle joins the psoas and then becomes one where it attaches down to the lesser trochanter of the femur. So the main thing I want to get across is that this is really very safe area for you to be working on this muscle. And we'll talk about how to do that later, but I wanted you to get just a view of the area. The only organs that are really around here that you have to be careful of would be the ovaries. And you can see right here the two ovaries where they lie. They're significantly toward the inside of the psoas muscle, and the bladder is right down here. So we're going to be working right around here, and there really isn't much danger in you approaching any organs or causing any problems there. So be confident, know the terrain, and that will help the quality of your work. Another area that you're going to need to exercise caution with will be your older clients that come in and have had hip replacement surgery. Again, this is a wonderful area that you can really create a lot of freedom of movement and a lot of improvement with these clients, but both the clients and you need to know what are the right movements to move this hip through. Generally, the surgeon will have told them what areas to keep away from as far as movement, but it is important for you to know where you do not want to move the hip, what ranges of motion. So let's talk about those. Keeping in mind, these are the movements that you do not want to do. Joel's got a nice, comfortable hip here, and I'm going to be running through some movements that I would not be doing with people with a hip replacement. The first area I want to talk about would be the movement of the leg past the midline. Any adduction past the midline, you can see how this acts as a lever that could pop this hip out of the joint. So you want to be very careful about moving the leg into adduction past the midline. Just don't do that. The other area you want to move in, generally the hip moves into external rotation fairly easily. So although you're not going to really be emphasizing rotation, you don't want to be moving into internal rotation. So in any position, you want to keep away from internal rotation. So let's talk about rotation of the leg. And it is safe to move into external rotation if you do it slowly and don't come anywhere close to their end range. A lot of people have so much fear that they've really tightened up in this area, and working in the hip area in different movement patterns can really provide a lot of work. So just be cautious that you don't internally rotate the leg, and that when you externally rotate, you move very slowly, and always be talking with your client to have them tell you if they don't feel safe with that. You can even, of course, work with the knee down fully extended with internal and external rotation with quite a bit of safety. The only other movement that you want to keep away from with an artificial hip would be you don't want any hip flexion greater than 90 degrees from the body here. So it is probably safe to move it up a bit more, but I usually keep away from even approaching 90 degrees and probably stop at 80 degrees and then work with movement. And this can be, we'll talk more about how to work with the hips, of course, but this could be something that you could really work with a lot of benefit to people, because this area gets very fibrosed from lack of movement and from scar tissue. So don't be afraid to work around artificial hips. Just know what your limitations are. Let's move up the body to the trunk area and just talk about some of the areas of caution here. The major one that you're going to want to think about is the liver lies right underneath these bottom ribs on the right side. So I do a lot of work with abdominal muscles. Some people really are tight in this area and they have breathing patterns that need to be freed up, but you're not going to be sinking straight into the liver or going underneath the ribs too much here. On the other side, this is why it's important to know what you can and can't do. You can give tremendous benefit to people by working on the anterior part of their diaphragm when they have breathing patterns that have a lot of stress. So again, learn how to work in this area, just be cautious of the liver. The xiphoid process right at the bottom of the sternum is another area you want to be very careful about working around. I really don't see much benefit of doing much work around the xiphoid process. So just be cautious of this. You know, it's this little protrusion of bone right down at the bottom of the sternum, and people feel very vulnerable about this. Okay. Let's move on up to the shoulder area, and we'll talk about the thoracic outlet area. Right here where the clavicle comes together and meets it's called the AC joint, right up here where the shoulder joint is, there can be tremendous tension for people. People that are working computers can have a thoracic outlet syndrome where all of this gets compressed and these nerves here get compressed. So let's take just a little break and look at an anatomical drawing so you can see what that will look like in a drawing. The thoracic outlet. Notice how tightness near the clavicles and beneath the pectoralis minor can cause impingement of both the nerves and blood vessels as they travel down the arm. Also notice how raising the arm above the head can increase that pressure. So what you want to be careful of in this area is that you're not compressing all of these nerves and veins that are traveling out underneath this clavicle here. And you've seen from the drawing where they move, you want to keep the arm in a fairly neutral position. So if you're moving the arm up, you can see how that's going to be stretching these nerves. So generally when I work in this area, I keep it in a softened, unstretched position. Just know where the nerves are, and we will be talking later about strategies for working in this area. Let's work our way down the arm. The first area that I want to mention would be the axilla, or the armpit area. So I'm going to bring Joel's arm up. And this is an area where there really aren't compelling reasons to work around, and actually some reasons to not work here. I pretty much just stay clear of this area. You have numerous lymph nodes, descending nerves, and just a feeling of vulnerability with many clients. A little posterior and inferior, however, it is really important to be able to address the origin of the triceps and also the teres muscles. So just stay away from the axilla. There's really probably the potential benefits are outweighed by the potential dangers there. Okay? The inside of the arm, in between the biceps and the triceps here, is another area that you have nerve access. So although you can do an awful lot of work working on the arm, on the triceps and on the biceps and do a lot of benefit, I do keep away from very deep work in between the septum for the muscles here. As long as we have the arm up, let's talk about shoulder instability. Generally, your client is going to know if they have a shoulder that isn't stable. The main thing you do is if somebody warns you that they have a shoulder that comes out of joint, I generally work with the arm in a neutral position. I certainly work on internal and external rotation of the humerus, but I do it with the arm adducted fairly close to the body, and I don't abduct it above the head. Generally, problems with dislocation come with abduction, which is bringing the arm up above the head, and external rotation. So here's external rotation. In this position, above the head is where the shoulder is most vulnerable. This isn't as much of a danger with internal rotation, but you still need to be careful because it depends upon which ligaments have been compromised. Let's move down the arm and talk about the ulnar nerve, which travels down the back of the arm and comes up near the surface right near the olecranon process here in the elbow area. So this is an area that you want to be very, very careful of working on, but that can get very, very fibrosed. So again, don't just shy away from areas that you need to have caution with. Learn what the area feels like so that you can work safely. There's a lot of fibrosed area for people that lift weights here or that are working with computers that you can give a lot of relief with. So learn how to work around here, but realize that the ulnar nerve is right down here. The front of the neck is one area that is probably the most fear-inducing for new massage students. A lot of early classes, I think with good cause, again, tell students never to work on the front of the neck. But that's before these students have developed their tactile skills and can differentiate between tissue. So once you're fairly adept at your anatomy and you're ready for it, I think the front of the neck is a wonderful area to feel confident in working, and it can also give you an awful lot of benefit for people with neck pain because a lot of the muscles in the back of the neck that are complaining are actually fighting against tight anterior muscles. So one of the ways to really start becoming confident in that area is to work on your own neck. So I very often take my hands when I'm lying down and just take my thumbs and feel tissue and start learning. What do the lymph nodes feel like? What do the salivary glands feel like? And then work my way down and start feeling these different tissues after I've studied the anatomy and get a sense by working on my own neck about how much pressure feels safe and all of that. So one thing that you can tell, the carotid artery is an area, of course, that requires an awful lot of care on your part. Because particularly for older clients, it can be holding plaque that you can dislodge if you work on this, and that could actually travel up to the brain and cause a stroke. So you certainly should know what the carotid pulse feels like, and one of the best ways to work on that is on yourself. So just take your hand and reach across your neck to the opposite side and use nice soft fingers and slowly push in and feel this carotid pulse, realizing that if you push too hard, you're going to make the pulse disappear because you're going to be cutting off flow in that artery, okay? So then when you have a sense of that, then you can be moving to working on your clients. So the other areas in the neck that you want to be careful of, I do a lot of work on the sternocleidomastoid muscle, and we'll be talking about this later, but the jugular vein does run superficial to that. So just get a sense, feel for veins, and be very, very cautious in this area as well, but don't be afraid of working on that sternocleidomastoid muscle. It's a very important muscle to work on. Moving down a little bit, again, as we've talked about, the thoracic outlet area here, you do have the nerve plexus here that you're going to want to be cautious of, but right underneath the clavicle is the subclavian artery, and it is beneficial to work in this area. The subclavius muscle can get very tight, but just feel for that pulse and realize when you're right near that artery and move your hand away. I mentioned this earlier, but the same thing with the carotid pulse. If you feel the carotid pulse, instead of shying away, very, very cautiously move closer to that pulse so you can tell exactly where that artery is. And then if you move a quarter to a half an inch away, you know you're not going to be pushing on that artery. You do, of course, have lymph nodes coming all the way up the neck and up to the skull here. So just get a feel for what those lymph nodes feel like and just realize that you're going to be moving slowly and you feel that sort of slippery, different type feel of the lymph nodes. Then you're going to move slightly so you're not putting pressure on those. Let's take a look at the head and talk about some of the areas on the skull and in the back of the neck here. The head and the occipital area back here are worthy of a few mentions, but although there's really not a whole lot of area that you need to be extremely careful of. Right beneath the occipital ridge here, a lot of people do a lot of work about providing traction and taking your hands and pulling the neck. Right below the occiput in the foramen magnum is the basilar artery. And what you want to be careful of is just using too sharp fingers and really pushing up too much. You want to be careful of moving the head back into extension too much. That can compress this artery, okay? In the side of the neck, right up through the transverse processes, only closer to the body of the vertebra, is the vertebral artery. And this area you can do a lot of very, very beneficial work on the neck, but you want to just be a little careful that you're not compressing that artery. And one of the ways you can do that would be by doing too much side bending, which could sort of put a kink in that. If you have the head in a neutral position and work unilaterally, you can be pretty safe working on the side of the neck, and it's also very important to be able to do that. So just don't work bilaterally on the side of the neck, and don't put too much movement in side bending in that area. Moving up to the skull, one area that's mentioned, if you look at a skull or an anatomy book, you can certainly see the styloid process back here. The reason I'm mentioning this is not so much that you need to exercise great caution here, as that this is really, really covered by a lot of muscle and a lot of tissue, and I've never heard of anyone actually doing damage to the styloid process. You should be aware of that. You don't want to push directly in against it with shearing force, but don't let that picture that you see in the skull frighten you from keeping away from this mastoid process right here, which is such an important area to work that we'll talk about later. Then we come into right in front of the ear, right near where the jaw comes together, is an important nerve that you do want to be careful of, and I have heard of therapists injuring their clients, and this is the trigeminal nerve. And you want to be very careful of the trigeminal nerve. If you push too hard in here, you can create a condition called Bell's palsy, which is a very serious condition. Bell's palsy can be very painful and debilitating. It can cause paralysis of the facial muscles of expression. The face and lips can sag around the mouth. So be very cautious right in this area working with cross fiber strokes or deeply or too fast. This is a vulnerable area. The trigeminal nerve then travels deep and then comes back down right about here in the chin area, and that's another area that you want to work fairly carefully around. And that there's not a lot of good reason to work in this area. There certainly is on the masseter and all these muscles of mastication, but this is not an area that you're going to want to work deeply on anyway. Okay? I've mentioned earlier, you have the submandibular salivary glands. This is an area you also want to be careful of. The last area that I will mention is a bone called the sphenoid bone, and go to your anatomy books and look at this, but basically it's right where the eyebrows come out, and a little bit behind and a little bit lower is the sphenoid bone. And this is a very delicate bone, and you can disrupt it if you apply a lot of force So I generally tell my students, as good as it feels to work in the temples, to know where the sphenoid bone is so that you can do this important work. I pretty much keep away from working on the sphenoid bone, even lightly, because craniosacral work, and I strongly recommend taking a craniosacral class sometime, works with this, and it doesn't take much pressure to be manipulating the sphenoid bone. So these are the major areas that I would like to have you exercise caution around, but also feel confident to work around. This is not all inclusive. I'm making the assumption that you've always been trained in your safety, and the final warning I would give is if you don't feel safe working around an area, do not work around it. It may be required for you to just take a class, ask a teacher, or something so that you can gain the knowledge to feel safe, but if you don't feel safe, that's going to be reflected in your touch, and it's going to have a timid, sort of tentative feeling, and you're probably not going to be accomplishing much anyway. Now that we've covered some of the basic issues about touch and about biomechanics, I'd like to start talking about the tools that you have at your disposal. What we will be doing is moving from fingers to knuckles to fists to forearms and to elbows. The basic theory that I have behind this is that when each one is, for the most part, increasingly more powerful